Spencer's still in So he's moving.
Thank you everyone for being here this morning. We will begin hopefully right on time, right? A little bit, 2 minutes. I want to recognize a few individuals joining us here today. We have City Councilor Richard Capaceras here with us. Thank you for being here. I don't have any other councilors written down. Do we have any others? No. Okay. Well, we do have Carol Fiola, who chairs. Chair?
No, member of
the House Committee, Joint Committee on Mental and Substance Abuse. So thank you for being here, Carol. Representative Alan Sylvia is also here, and a representative from Representative Paul Schmidt's office, Anthony Ballou, is also joining us. Thank you for being here. So today, we're very excited to announce something that is very important. It's going to bring Fall River to a more comparable place with other communities. We are proposing and announcing today a substance abuse prevention coordinator here in the city, and that is Michael Aguiar, who is here. Thank you for being here, Michael. And what this position is going to essentially do is coordinate multiple efforts throughout our community with all the different nonprofits around substance abuse prevention. We'll also be writing grants, internalizing a lot of our grants, so that we can create a more sustainable solution to some of our drug problems. I'm going to bring up the chief, who's going to talk about some of the issues that we've been facing in the past and why this particular position is going to be valuable for the police department. Chief?
Sure. Good morning, Mr. Mayor, and good morning, everybody. And first and foremost, I want to congratulate the mayor and his leadership with this particular issue, and welcome aboard Mr. Aguiar, who I've worked with for a long time, and he is really a true professional in this area. So we look at the problem, and to illustrate the problem we have to my left and my right, some statistics dating back from 2011 to the present. You can see a steady rise in overdose calls, I believe, to my right. Yes? From 2011 to 2015, ending at 655 overdose calls this year, 2015. Significant increase in the 300s from 2011. So to illustrate the significance of the problem, we brought that graph. And also here to my left are the deaths. While we're down in the deaths a little bit this year, it's certainly nothing to bugle about. I still think it's significant because if you correlate that with the calls, we still feel we have a significant problem relative to opiate abuse and drug abuse and overdose deaths and calls for service. To combat in some degree, we're shifting the focus of law enforcement away from law enforcement to more of a public health issue. So we have a pilot program going on now that the mayor is supporting, where a Fall River police officer is going out into the community to the home where an overdose victim recently overdosed, and there's a history of overdose in the family, in the household of that particular individual. So it's a pilot program to try to get services to these folks to get them back on the right track, an intervention program, a critical piece in reducing our overdose issues in the city and beyond. So we have a significant issue with heroin, opiate, and pills, overdosing and drug use and abuse. So this is a way of combating that. And I think the addition of the counselor is fantastic, and we look forward to working with him. So thank you.
Thank you, Chief. A couple other people I do want to recognize here joining us. Mike Jackman from Congressman Keating's office. Thank you. Congressman has been very supportive of the drug epidemic that's here in Massachusetts, and I know that we'll be working closely with him. We also have Peter from Senator Roderick's office. Where are you, Peter? There you are, Peter. Thank you for being here as well, and we look forward to working with the senator on this as well. So just a couple details about the position that I want to go into. As the chief said, we're really looking to talk about drug abuse here in Fall River as a public health problem, not as a criminal action. So that's something that we really have to get used to. Of course, as you look at the charts, you can see that this epidemic is really causing a strain on our police department and our community, and it's stifling us moving forward. So this is something that we're going to be very active and aggressive on, but again, it's going to be a change from criminal to public health crisis. So we're very excited to announce this position. This is a zero-cost increase for our budget, and that's really the theme of our administration. We're going to make sure that every time we propose a new position, we're consolidating some underutilized services. Where the funding for this position is coming from is an elimination of a $22,000 part-time nurse position. Many of you in this room know, and the greater public know, that nowadays you can get a free vaccine at almost any CVS and Rite Aid. So that internal individual is not really necessary anymore. Michael is also bringing over some grant funding from MOPSI, also bringing over some grant funding from STAR, and internalizing a lot of that stuff here in Government Center. We're already writing so many grants here in the city and then subbing them out to other organizations, which is great. But a lot of this can be internalized and coordinated, which is exactly what Michael will be doing. So the chief spoke about his first initiative, which is to work with the police department on a follow-up. I would say it's a follow-up, chief, making sure that the individuals that have a first-time call are being followed up with, and that we can really prevent further calls in the future and hopefully further overdoses. That's the goal. We're going to be data-driven. Something that we're doing that I think is going to be really incredible is looking at strategies on how do we track the follow-up calls, which is not being done right now. Am I correct, chief, in saying that? Which is not necessarily being done, so we're excited about that. The second initiative that Michael will be leading will be looking at how do we really bring these programs to the middle schools. How do we get curriculum-based or education-based programs within our middle schools? Today, a second announcement that's a surprise announcement is we're announcing we are the recipient of an $85,000 grant every year for the next 5 years, and that is through PFS 2015. And that'll be specifically focused on middle schools, something we look forward to working with the school committee on. And I think that's all we have for the announcements. We'll be answering questions separately right after the press conference. Thank you all for joining us, and we look forward to this position and the great work that Michael will be doing. Thank you. So Mike will be coordinating those efforts, seeing, okay, is there a place for them to fit at an existing organization? Do they need funding from the city? What do they need? So that's going to be very important. And then another key factor is we're going to be able to coordinate efforts all the way from the federal level down to the local level. So that coordination will take place in all parts of government. That's an important piece.
Now, Jasiel, why didn't you adopt Project Angel and call from your stuff there, questions asked, get treatment?
Well, that's exactly the reason we need to start somewhere. The starting point is a coordinator for all things drug abuse prevention. So Mike's going to be looking at a lot of these strategies and assessing what really works in other communities, what doesn't work, and what we're working on already. We're going to be working very closely with the police chief. That effort was also headlined, brought forward by the police chief. We're looking with our chief to work with other communities.
Jasiel, do you have a timeline on when you want to bring programs into the middle school? It's been talked about fourth quarter last year.
It's been talked about for a long time. It's a curriculum-based issue, so we've got to really negotiate with the school committee and see what we want to do. It may not start with just curriculum-based, maybe more of after-school programs, things of that nature. So we're looking at that.
Did you have other candidates in mind? How did you come up with this decision?
I've known Mike for a long time, and Mike, if you look at his resume, is probably the most qualified person for this particular job.
I do.
Okay, well, hopefully.
Hopefully,
We'll get through
you never know what's going to happen, right?
Okay, you never know.
Thanks, Joe. Hey, guys.
Well, as point person, what's the first thing you have to do? What's the most important thing we have to do as a community?
I think it's just figuring out what is being done and what needs to be done. I think everyone is doing something, and there's a lot of great work that's been going on, and people have been dedicated to this for a long time. It's just putting all the pieces together and having that focal point where I can look at everything that's being done from one perspective and then figure out what needs to be done from that point on. Because there are definitely gaps. Everyone's pretty much follows the funding, or we have volunteers that do certain things in recovery, but I think there are some gaps that need to be addressed. But we need to identify what that is by actually seeing what's being done first.
Right, and this problem spiraled out of control, especially with opioids.
But that's not specific to Fall River. That's national. That's everywhere. It's not just us. So.
The Gloucester plan, we've heard of it.
Yes.
Maybe it works. I guess it works for some.
It works as an individual program, but I think if there were many programs like that, it might not work. There's a limited amount of bed space, so I think that's on a whole different level, is getting more treatment beds available.
Yeah.
And I know our local agencies are working on that too.
When do you think you'll have a viable plan, or at least some steps to take?
June 30th. Actually, I need to have a strategic plan done for the PFS grant by June 30th. And I'm planning on incorporating everything at the same time. So I should have a good strategic plan for the city set up by June 30th.
All right.
That is the deadline for the state, so it makes sense.
This is a huge problem. Mm-hmm. It seems like a very daunting task to figure out how we're going to get people to not use opioids in the city of 85,000, 90,000 people. Feel that way?
Yes, I agree with you. I wish I had the magic bullet answer, but I don't. If I did, I'd be a multimillionaire today. But it's going to take a lot of hard work, and we're going to do our best. If we can see any kind of decrease in numbers, then I consider that a success. The numbers are out of control right now all over the country, and if we can show a difference here in Fall River, then we know we're being effective. And I believe we can do that. We have enough talented people here and committed people here that we can get this done. At least make a dent in it.